Dr. Rebecca is a clinical psychologist from King's College Hospital, and she's with us today to talk about mental health, and particular how mental health impacts and plays a part in the workplace. And Dr. Rebecca has worked in the UAE for over 5 years and has over a decade of experience working in both hospital, outpatient and private clinical settings. And further to her individual work, Rebecca works closely with schools as well as other organisations, with her focus being on education, educating others about neuropsychology and sharing her knowledge and expertise in the field. There will be time for question and answers at the end. If you can please put that in the chat box, and this session is being recorded. So Dr. Rebecca, thanks so much for being with us today. And if you don't mind starting your presentation, we really look forward to listening to you, and thanks again.
Thank you so much, Catherine. Thanks for having me. And thanks to everyone who's joined. I think I see a few names that I might actually recognize, but it's lovely to have you all with me today. As Catherine mentioned, I'm just going to be speaking primarily about how to create a mental health friendly workplace. As we all know, with the pandemic and the impact that it's had on individuals' mental health, there's also been a significant impact on the corporate world as well. And with people working remotely, there's a lot of isolation and a lot of anxieties that people have been experiencing as a result of a lot of changes in the way that we work. But also, I think many of the issues we have in the work environment are quite systemic and have been, experienced across generations and across cultures, across the world, essentially. And so none of what you probably will hear today will surprise you. I think it's important to note that there are a lot of companies in Dubai who are really working towards improving mental health offerings within their workplace. And so your organization involving like webinars such as today, there's so many different trainings that people can do to help become a champion of mental health within the organization, and to really be there for one another. So what I will also be talking about today, as you will see, is learning a little bit more about how common mental illness is, that there are effective treatments and that people generally do recover from mental health challenges, and also specifically how your workplace might benefit from mental health friendly policies and practices. But more important than anything is actually, what does it look like? What does a mental health friendly workplace look like? What does it do and how does it function? So let's start with basically looking at what is mental health. The World Health Organization has described mental health as a state of well-being in which every individual realizes his or her potential, can cope with normal stresses of life, and can work productively and fruitfully, and is able to make a contribution to his or her community. Now, when we look at mental health conditions, one of the diagnostic criteria we look for is whether there is a clinically significant impact on that person's ability to function within their personal lives, so in their relationships, within their family lives, as well as within their occupational world or academic world if they're students. And so this is really why it is so important to focus on that very important element, being the organizational world that they live in, given that majority of our days are actually spent in the workplace. So there are a wide range of mental health disorders, but here is just a short list of some of the more common ones that you may know people experience or may potentially have experienced yourself. That includes depression, anxiety, burnout, which can lead to clinical symptoms of anxiety and depression, sleep disorders, substance abuse issues, eating disorders, bipolar disorders, and schizophrenia and other psychotic disorders, which are a little less common. So there is so much more to mental health, I think, than we are even conscious or aware of. And mental health is more than just there being an absence of mental disorders, because everybody experiences variations in mood and struggles that may affect their mental health to different severities and for various lengths of time. I can safely say that pretty much everyone on this call, including myself, has experienced life stresses which would have affected mood. And sometimes these are long lasting and sometimes they're very temporary. But it's important to know that these normal ups and downs of life are part of what just sort of general well-being and health is about. But if a person's mental health is suffering because they have not been diagnosed, or they have a significant range of symptoms that have not really been understood or dealt with, that can lead to mental challenges and hopefully what would be diagnosed and treated. So there are such things such as death or stress, for example, that can affect our mental health. But mental health is such an integral part of our health. And indeed, there really is no health without mental health. That's basically my philosophy. I practically say it every single session when I meet with my clients, because I think people feel that they are more comfortable with prioritizing their health over their mental health. And I think that's largely to do with the stigma around mental health. If we have a medical illness, we often don't have any problems asking our managers if we can get sick leave certificate. But if we're really struggling with our mental health or experiencing burnout, really need to take a break, there's a lot of anxiety around even requesting leave as a result of mental health challenges. And that's something that I think many organizations really need to focus on addressing. What we do know also is that mental health is determined by a range of socioeconomic, biological, and environmental factors. So where you live, how much money you have can also affect that on either extreme, but also biological factors, meaning is there a genetic contribution to some of the difficulties you experience within your mental health, and how much of this can be managed and also preemptively managed, especially if people are very much aware of the family history. So another thing to touch on, and I know this is a very taboo topic, especially in this region, but mental health and suicide risk is so critically important for us to consider. And suicide is a very complex issue, involves a number of factors, and it really isn't often attributed to any one single cause. Not all people who die by suicide have actually been diagnosed with a mental illness, and not all people with a mental illness attempt to end their lives by suicide. However, the risk for death by suicide is really significantly increased if there's a person who suffers from depression, alongside psychotic disorders like schizophrenia, bipolar, substance abuse, and anxiety disorders. And it's important to get treatment for a mental illness, particularly if there are suicidal thoughts or behaviors that are demonstrated by people. And sometimes it's very hidden and it's really hard to know, which is why it's important that this is something that is discussed openly and without shame or stigma. So how does the workplace play a part in mental health? It actually plays an essential part in maintaining positive mental health. And although we can be in a stressful work environment, we know that this can contribute to the rise of mental health problems and illness, but it can be managed. And it's important to note that there is no workplace in the world that is immune to these risks. Even like fantastic workplaces like we all hear about Google, where they provide, free food and all these exciting tech, freebies that they give to their staff members, and flexible work arrangements and things like that. Those environments are still likely to experience mental health challenges or stresses or factors that would impact a person's occupational health and safety. Mental health is just as important and cannot be overlooked. I would say that people are more attracted to workplaces that talk, even in the interview process, about their mental health policies and what they provide. And now that's also been included in health packages. So health insurance companies are asking their health insurance to extend the mental health offerings so that psychiatry and psychology can also be included. And I find it really remarkable living in the UAE how few people have mental health coverage in their insurance plans. And I think this is something that really needs to change, and the corporate world really needs to advocate for that as well. So having a mental health friendly workplace involves caring about policies and practices and making sure that they focus on increasing higher productivity and motivation, reducing absenteeism, health insurance element that I've just mentioned, and an environment that creates safety for those struggling with mental health challenges are going to have a greater amount of loyalty to their work environment and greater staff retention, which I think is really critical because people do, especially in the UAE, tend to move jobs quite quickly. I mean, some people stay in jobs for only a year to 2 years maximum. And major reasons why they end up leaving is because they don't often feel that all of their needs are being met in that environment. So when we do have policies and practices in a work environment that do focus on creating a mental health friendly environment, you're more likely to have greater diversity in your work environment. You'll have more acceptance and respect in the workplace, and communication, collaboration, all of that will significantly improve as well. So if you are a manager or supervisor, and I'm not sure if any of the people on the call today are, but this is not only just relevant to you if you're a manager or supervisor, but it's also important if you do have a manager or supervisor, and how they can also be made aware of some of the things that they can do to make a workplace that thrives. So it's really important for you to know the policies and practices within your organization. And that involves understanding what employee assistance resources there are and actually publicize them. A lot of people don't even really know that their employee assistance resource may include a few sessions that are paid for with a psychologist external to the organization or within the HR department. And the fact that they don't know about it means that they don't necessarily know how to ask for it, and there are resources that are just not being utilized effectively. It's really important as a manager that you are open to making reasonable accommodations. So if somebody is really struggling and they need to take some time off, or it's important that they be taken off a certain project, or their requirements of their job are minimized to some extent for a period of time, being open to that and being non-judgmental about that is really critical. Also being aware of what a person's rights are. I don't really think it's always very clear what employees' rights are. And I don't also think that employees really know what their own rights are. And so having a really open and transparent public way of accessing this information, and whether that even be written into the contract, would also be very helpful. So they can employees can always refer back to them and understand what their rights are and how they can utilize what their offerings are within the organization to help themselves. It's important also as managers to be creative and try to work with your employee to understand what would help them most. For some people, taking time off would actually be terrible for them. Maybe they do need to stay at work, but they may need to be moved into a different work environment or a different team if there are complex dynamics or toxic relationships between colleagues that are contributing to that person's stress. So it's also important to think about not just how to maintain that person's mental health, but find a way for them to be able to stay within the work environment to a point where they can see that they can improve whilst staying at work. So reasonable accommodations, like I mentioned, being creative about that involves looking at modifications of a person's schedule. So people who are on shifts are likely to struggle with sleep issues, could impact their relationships and their family lives. So looking at modifications to a schedule if someone's doing really late shifts, or if somebody is really working extremely early in the mornings, how can they finish work earlier and how they can create a good work-life balance with your support. Also looks at job modification. Can the tasks the person has been assigned be changed? Modifications to the physical environment, potentially allowing the person to work from home or moving them to a different part of the office where they might feel a bit more comfortable or be surrounded by colleagues that they have a better relationship with. And I think even modifications in the physical environment can include, encouraging the employee to set up their desk or move their desk or sit by the window, or any small changes that can make it more tempting and inviting to be sitting at their desk. Accommodations also look at changes in policy, and sometimes companies are only really aware of the fact that they need to change their policies when they have a person who's really struggling. Then they look closer at what they've got in place and realize that it's very lacking or there need to be modifications. Provision of human assistance. Does this person need someone to support them rather than observe them or manage them too closely, but just be there as a sort of an additional assistant? provisions of assistive technology if that person needs it. And by assistive technology, I also mean things like making the work environment more comfortable for the person. That can include giving them the iPads or alternative bits of technology that may allow them to step away from a physical desk, and maybe they can sit in a couch area or in the staff room area while they're working, just to create some changes in their environment. And also looking closely at your supervisory techniques as a manager. Do you micromanage? Are you really tough on your teammates? Are you someone that they can approach? And are there things that you can try to do differently to help allow the space for people to express their needs from you? So a supervisor should really avoid trying to diagnose a problem by themselves. If they identify that there's a mental health concern with an employee, it's important that they try to learn about the various different types of mental illnesses people might experience in the work environment, and also try to provide initially some sources of help, whether that be looking at different clinics or psychologists in Dubai that might be able to help them, or whether that be printing out informational resources or connecting them with books or reading materials that might be helpful for them. But the important thing initially is to recognize behavior that signals distress. And these are some of the more important ones, such as any displays of anger or blaming others, if there are any safety risks or accidents, and especially if these seem to be occurring on a regular basis. Frequent absenteeism, calling in sick on a Monday morning when they seemed fine on a Friday, and if these things are happening on the regular. Consistent tardiness, so coming late to work regularly, having excuses about why they're late to work, often complaining of feeling tired, looking extremely tired or unkempt, like not really taking care of themselves in the way that they present, in how they dress and how they take care of their themselves, is also something to look out for. And if you notice that there's any decreased productivity, especially people who are generally tend to be very productive, they're not meeting deadlines for any particular reason, and if there's a sense of low morale, just feeling disappointed in where they're at in their work, and feeling like potentially unable to manage the expectations around productivity. So other behaviors that signal distress also focus on, how the person seems when they're in the work environment, and that looks at if they have difficulty concentrating or making decisions, or perhaps they seek a lot more reassurance than they used to, or have difficulty remembering things and things fall through the cracks. If a person is working excessively over time for a prolonged period and you become aware of it, it's really important that you consider that this may be a huge factor in how their mental health is going. If they complain of unexplained aches and pains, or they generally don't seem like they're willing to cooperate with others, or have more conflict than usual. Also, and this probably doesn't happen very often, but someone expressing some strange or grandiose ideas, such things like some paranoia, believing, for example, that everyone's out to get them, things that are very unusual for that person and that hasn't ever been expressed before, would be a warning signal to keep an eye out for. And also looking at, how someone spends their downtime, and alcohol, and maybe less so in Dubai, but alcohol especially, is something that has a significant impact on mental health and can be abused outside of the work environment and outside of work hours, but can also happen within the work day as well. I'm not sure how often that would actually happen, but I know, working in Australia, that for people who have severe anxiety, alcohol is something that helps them get through the day, and they may have alcohol in their lunch breaks, and sort of whenever they are able to sneak out and have some. So what else can a manager do? It's important as a manager, you're at that position as a manager for a reason, in that you are skilled in managing people. But as you are skilled in that area, it's important that you use those skills to make the workplace feel safe and comfortable for all employees. And that might mean discussing changes in work performance with the employee whilst fundamentally maintaining their confidentiality. Anything that someone shares with you needs to remain private or needs to be dealt with sensitively. Otherwise, they will not seek you out for support. It's also, like I said before, important to become familiar with what resources are available to assist an employee, and just working hard to look for signs and recognize when an employee is experiencing mental illness or distress, and whether they may need a flexible schedule during their treatment. So some suggestions on how to start a conversation, and as a manager, it can be really tricky and very uncomfortable because you don't want to offend, you don't want to exacerbate their issues. So approaching it in the most sensitive manner is really, really critical. And here are some sort of little scripts that you might like to use. You might say to an employee, "You've always been such a reliable person on our staff. Your quality of work is really strong and always on schedule and within budget. But I'm a bit concerned that recently you've been late to work often, or you're not meeting your performance objectives. And I'd really like to see you get back on track. Is there anything that you can think of that would help you get back on track? And is there anything that I can do to help with that?" Another example might be, saying something like, "Susie, I see that you seem sad, and it seems to be affecting your work, and you're not really meeting your deadlines. And from time to time, I find that it's very natural for people to get down, and many times it just helps to have someone to talk with." And you're then able to offer resources and to follow up if the person is open to seeing someone. Another example is like, "Let's get together in 3 weeks from now and we can talk again. We can see how the work is going and if there are any changes that need to be made." Another approach is, "I don't know if this is the case for you, but if personal issues might be affecting your work, you can speak confidentially to one of our employee assistance counselors. The service was set up to help employees, and you can discuss with the counsellor whether you might need any accommodations or supports. And our conversation today and the appointment with the counsellor will be kept confidential and will not affect your job." And I think that final statement is really critical, and it's something that maybe people think goes without saying, but it needs to be said so the person actually feels much safer in going ahead with seeking that kind of support. So within the work environment, we may experience the stresses and feel like we're maybe burning out. So it's really important to consider and to reflect on, what does my self-care actually look like? And self-care is more than just having a hot bath or getting your nails done or going for a massage. It refers to the activities that are undertaken on a regular basis with the intention of enhancing your energy, restoring your health, and reducing your stress. And the benefits of self-care are that it allows you to have greater capacity to manage stress, because the work environment generally will go through phases where your stress will be increased. But it increases your resilience to coping with stressful periods of time, and also then likely it reduces the symptoms of mental health problems and prevents further exacerbation of that. So I love this little infographic at the bottom here, where it highlights that self-care can be about so many different things, like asking for help or spending time alone, setting boundaries, putting yourself first, asking for what you need, sometimes deciding to stay at home or work from home, saying no, or asking for time to think about things before committing to tasks, allowing yourself to take a step back and to reflect and ensure that you forgive yourself for when you don't always meet the mark or don't always behave within your highest self. So what is the value of self-care? Self-care is not selfish. It allows you to increase the enjoyment of life in general. It helps you cope with stressful events and sadness, achieve your goals and your potential, and maintain positive connections with others. It also ensures that you are better equipped to support the mental health and well-being, not just of yourself, but of your colleagues and your family. What self-care is not, it is not something that requires an elaborate plan. It's not complex, and it doesn't need to be. It doesn't have to be time-consuming or expensive, but it is also not unhealthy coping mechanisms like drinking, overeating, risk-taking, or going too hard with this whole concept of work hard, play hard, which can then significantly impact coping as the week progresses. What we generally tend to think self-care is me first. What actually it means is me too. So self-care, again, it focuses on some of these things, like mindfulness, slowing down, taking pleasure in small things, having more awareness and seeking support, trying to comfort others and knowing that and being open to being comforted as well. So there are some challenges, and I think it is very much focused on your mindset. The carer mindset that some people have is that it's more important to help others, I'll be fine. And we often find this with working parents where they are just running off their feet. I am one, I know what it's like, running between school pickup and meetings and trying to make everything work, and meeting everyone else's needs means that we often don't slow down, and we don't also consider the fact that we need a moment to compose ourselves and actually seek support. And whether that just be coming home and leaving the home environment just for 20 to 30 minutes to go for a walk or to sit in the garden and have a cup of tea, all of these things are really important, and they're just really small things that we can do. There's also the superhero mindset, which is I should be able to cope. I've always been able to cope. Nothing really should get in my way. I'm infallible. And the reality is that no one is, and none of us are superheroes. The time mindset challenge is that I'm just too busy. I just don't have the time. I can't exercise, or I can't find time to take myself out and do something pleasurable. And knowing also that we have competing priorities, that I will only be able to engage in self-care and to take care of myself when I finish X, Y, and Z. But generally speaking, our work requirements don't ever stop. And finishing projects, yes, might allow for you to have a little bit of downtime, but oftentimes it means that you just move on to the next thing. The perceived value mindset is, I don't actually deserve it. I haven't done enough to deserve it, or I haven't worked productively enough to deserve this moment of self-care. And if it's not part of your routine, it's very easy to turn around and say, I don't really have time to include it into my routine, therefore I will not do it. It also happens quite often, and especially for many of us who have parents who worked or who had extremely stressful jobs, our role models in our life were people who didn't stop and take breaks, or didn't seek support. And if you look at those people in your life, you will be less likely to try to include it into your day-to-day. So within the workplace, we also have to be role models for one another, that we can actually turn around to the person next to us and say, look, I see you engaging in self-care. If you can find the time for it, so can I. So here are some additional self-care ideas. And the Stress Busters one just focuses on very simple things like making sure that you eat well, you exercise regularly. And look, it doesn't have to be intense exercise. It doesn't have to be daily exercise. It's just light, moderate exercise as often as you can, whenever you can fit it in. And when the weather is better, it might be, walking in your lunch breaks or taking a few minutes to do some stretches. Any kind of movement is really critical. Trying to get as much sleep as you can, and try to, spend a lot of time in supportive relationships. A lot of people who work hard or who have busy home lives as well neglect their social lives and their friends, and friendships are so critical to maintaining balance. And mental health care, that involves not only just seeking therapy if you need it, but learning about it, attending webinars like this. My kids' school often offer webinars around bullying or mental health in children, and they're offered and they're out there, and we're the ones who just need to make the most of those resources as well. So this is something that, I'm sure you'll get a recording, but something that you might like to take a picture of, because when you're stuck and you're feeling overwhelmed, it can be hard to think about what elements of self-care you can do in that moment. And you actually will be surprised at how many things you could do. With some of the children I work with, I often help them put together a self-soothing toolkit. And that includes a whole bunch of these, including others that are a bit more age appropriate. But things like having a cup of tea and chatting to a friend in your lunch break might be very soothing. Having a candle, if you're allowed, at your desk, or using aromatherapy to help soothe your senses is important. Eating well, taking a walk, listening to meditation. There are breathing techniques you can learn. There's so many apps out there that you can use. Muscle relaxation exercises are very helpful as well. So that, as you will see in this infographic, there's just so many different things that you can do. And one of the things I think is extremely critical is journaling your thoughts. Sometimes when we're really busy and we're very overwhelmed and emotionally sort of not able to self-regulate, journaling your thoughts can actually help you recognize what aspects in your day-to-day are actually creating the most stress for you, and that will help you know how to prioritize dealing with them and what to do about them. So journaling can happen at any time of the day. It's a really nice thing to start your day journaling using sort of a gratitude journal, writing down 3 to 4 to 5 things that you're grateful for each morning, and ending your day journaling some of the things that happened in the day. What were the good things about your day? What were some of the challenges in your day? What could you do differently? How do you think you managed? And generally looking at, and journaling can help a lot with problem solving as well. And once you are able to reflect on the thought processes that you're having and how extensive they may be on certain problems, you'll be able to use that information to guide your management of that situation. So I've put together some reading resources here that I love and I think are really, really helpful. Nedra Glover Tawab is on Instagram actually, and she has an incredible Instagram account. But this is a book that she's written about setting boundaries. There is also sort of working on patterns of healing from your past, and that's written by Dr. Nicole LaPera. So that's about doing the work. So that by doing the work, we refer to the inner work. We work so much in our lives for others, but we do very little work for ourselves. Emotional vampires, dealing with people who drain you dry. I love this book by Albert Bernstein. It's a really helpful book to help you recognize who those vampires are in your life, how much power you give them, and how to set boundaries with them. And we may have these emotional vampires within our work environment as colleagues or as managers, and we may not be able to change that, but we can change how we respond to that. And Robin Sharma's very famous book, you've probably seen it everywhere in Borders, but in the 5 a.m. Club, Own Your Morning, Elevate Your Life. I'm not going to say that I am a 5 a.m. club member, but there's a lot of research that suggests that how you start your day and setting a very healthy and routine morning ritual can have a huge impact on your day-to-day functioning as well. And 5 a.m. club doesn't necessarily need to mean waking up at 5 a.m. exercising. It can mean waking up a little bit earlier before your alarm to do some meditation, to sit and journal, to call a family member who's abroad, maybe the time difference works out. Anything that enhances your well-being, that makes you feel safe and secure and comforted, stretching, little things like that can have a huge impact on how you begin your day. And some other resources. I do have an Instagram account where I put some tips and mental health related information on there. If there is anyone that you know of in your life, in your workplace, who you believe requires emergency psychiatric care, where you're very concerned about their safety and well-being, Rashid Hospital is the place to contact or to take them to their emergency, because they have an inpatient setup for these sorts of cases. Many psychology clinics and even hospitals like King's doesn't have a inpatient service for mental health challenges, so it's really important to go to Rashid Hospital. And if anyone in your organization feels like they may require support for their own mental health challenges, we have I'm the only psychologist, but we do have 2 fantastic psychiatrists on the team as well, who work across the Jumeirah Medical Centre, the King's Marina Clinic, as well as the hospital where I'm based. And this is the number for the call centre for any appointments. Okay, I'm done with the talk now, so I'm just going to leave it up to the attendees if you have any questions.
Dr. Rebecca, just before we have some questions from people on the call, just want to say a huge thank you for being with us today. I'm sure everyone on the call will agree it was very practical, and I'm sure everyone will find that the session was really helpful. So thanks so much for your self-care tips in particular, and very practical. And I love the stress busters. I don't think I'm a 5 a.m. person either, but I'll certainly be inspired to start the day more positive. So thanks again. Just while we're waiting on a couple of questions, and I'm conscious of your time as well, Dr. Rebecca, you mentioned the EAP, or the Employee Assistance Program, that, and I know there's some HR and management on the call, and certainly I'd just like to say to them, please feel free to reach out to myself to help support with some refreshers or some more information related to employee assistance programs. Again, thanks for bringing that up and pointing it out, because they are a huge resource available to people. Sometimes people don't even know that comes as part of their insurance policy. So certainly I'm here as the AES broker to help and support with that. So if anybody does have any questions at this point, please feel free to pop them in the text box, and we can answer them there. I see one question just coming in, Dr. Rebecca, if you don't mind. Where can I find support groups in Dubai? If you have any information on that.
Few centres in Dubai that offer support groups. It very much depends on the specific area you feel like you need support in. So if it's related to stress management, or it relates to parenting, for example, that might be impacting you. There are a few clinics out there that do. Vivamis is a centre in Dubai that I believe is offering some webinars. A lot of clinics were offering a lot more of this before. Especially online during the pandemic. And some of these support groups have sort of closed down a little bit because of reduced number of attendees. So in terms of stress management groups, I also believe that there is another center called Insights Psychology in JLT that may offer those as well. But I'm not exactly sure what's current and what their current offerings are. But those are the two clinics I would Google to see if they have anything that might help.
That's great, Dr. Rebecca. Actually, I do know those two clinics. So again, if anybody wants to reach out to me, I can share that information. Actually, somebody has asked, first of all, Abby, thanks. You've asked, that was a great webinar that I've been to. Can you advise of any support groups in Abu Dhabi, and which is the best hospital to go to in Abu Dhabi for mental health issues? I'm not sure, Dr. Rebecca, if you know, but if you do, great.
I don't. I used to work in Abu Dhabi. What I know about Abu Dhabi is that it's still really evolving in terms of what's available and what's offered. There's so many new clinics opening up. I know that there are some that have a sort of a greater presence, and I know there's like Cleveland Clinic that's in Abu Dhabi, and another hospital that is not coming to me, but I'll have a think about it, and I can always email through, that may have a mental health service. But I believe in the UAE, only government hospitals would have mental health inpatient facilities. So I don't know exactly what hospitals they are in Abu Dhabi, but it's definitely something that I could find out, and I could let you know.
Great, and maybe then I can share that with anybody that needs that information. So thanks so much for your question. I do have another question, which I think is quite a popular one, and I'm sure we've all been here. What support can I offer a friend or a colleague who I know is struggling mentally? Yeah,
so I think it's important to be very gentle and sensitive about how you approach it. If it is someone that you're close with and someone you speak to regularly, you may feel that you are the best person to raise it with them. And some of the scripts I put in the talk there can be adapted to, the approach that you have that conversation with that person. But I generally would approach it that, I've noticed, or I'm observing X, Y, and Z, and I'm a little worried. I know so many people going through this. I've been through it myself. I'm also really incredibly stressed. This is the stuff that I'm doing to help myself. do you need any help? Maybe you'd like to speak with someone. And on that point, there's a really, really great book by Lori Gottlieb, who is an American psychologist. It's just recently come out, called Maybe You Should Talk to Someone. And I think it's a great book because each chapter focuses on a client or a patient that she has worked with. And it just shows you the range of different things that people go to see therapists about, and often can be very surprising that people are experiencing so much distress and so much trauma in their lives. And, it helps to keep things into perspective. It doesn't minimize or diminish another person's suffering, but it's a really great way of helping someone understand why it's good to seek therapy and how they might benefit from it. And just saying that, would you be open for me helping you find someone to talk to? I have a friend who's been to see someone. They had a really good experience. They may be a good fit for you, and then coming up with some options and resources that might be helpful.
Great. Thanks, Dr. Rebecca. Just have one more question, if that's okay. At what point in realizing I am struggling mentally should I be worried or concerned?
So when you notice it's impacting your functioning in the various parts of your life. So within your home life, if you're finding that you are not as patient, not as kind, not as nice to be around, whether it be your partner or family members or your children, you'll often get feedback from the people around you, and especially your family. If they are saying, oh, mummy's crying too much, or mummy's always shouting, or whatever that might be, or daddy seems so angry all the time. If those are the sort of messages that you're getting, then there's an indication that something needs to be addressed. Also within the work environment, if you're struggling with motivation, productivity, when you're waking up in the morning and you're feeling a great sense of dread about facing your day, if you feel like everything just feels too much, you feel overloaded, you're not even looking forward to or able to enjoy things that you normally enjoy, you're putting aside your hobbies or the things that you do in your downtime and working during that time, or crashing because you're so exhausted and really sleeping too much can also be a sign, or not sleeping at all is like insomnia is a very, very big indicator that something is not right and that you might need some support.
Thanks so much, Dr. Rebecca. Do you have time for literally just one last question? Perfect. So somebody has asked about medication. At what point would I need medication, and what are the side effects of taking medication for anything related to mental health?
Sure. So medication is something that's managed by a psychiatrist. They are medical doctors. They work very differently to psychologists. They are there to diagnose and to treat from a medical perspective. And then the psychologist's role is to then help the person unpack what is going on in their lives and give strategies and directions on managing their coping. Now, I typically prefer to meet with a client first to help understand whether they may need medication. Sometimes I am referred to by the psychiatrists at the hospital where the person has sought consultation with them. They have thought that their difficulties are clinically significant and have already put them on medication to help stabilize their current difficulties. And then they're a bit more ready for therapy, in which case they come to me and they're actually ready to work on some of the difficulties. Some people are very, very symptomatic, in which case therapy is not the right thing for them. They aren't able to benefit from the process and they need medication to begin with. How to tell if you actually really need medication very much depends on the degree of distress that you're experiencing and the symptoms. So we're looking at important things like, are you able to sleep? Are you able to function in your work environment? Are you having panic attacks or anxiety attacks to the point where you're not feeling like you can drive or go to malls or go do things that you typically enjoy? If you feel that things are outside of your control, that is when you may want to consider medication. My preference generally is for me to do an assessment with a client but first better understand their level of symptoms and how much impact it's having on their day-to-day, and then with them discussing the process of seeing a psychiatrist and helping manage their expectations around that as well, and then making that referral. So that's how I tend to prefer to work, but it very much depends on the client. A lot of people have psychiatry cover on their insurance and not psychology. And so sometimes they have to see the psychiatrist first in order to help open up access to their psychology cover, which I guess is, it sort of relates back to a very traditional referral process. And sometimes they're in psychiatry, they feel like they get enough from it, but then the psychiatrist feels that they can't provide more for them moving forward, in which case they then send the referral over. There are so many different types of medications. There are antidepressants, there are anti-anxiety medications, there are mood stabilizers, there are medications that help with sleep, there are medications that help with acute anxiety. Every medication does have a side effect. It very much depends on the person. Some people will respond very well to the first medication that they've been put on. Some people will struggle with side effects that are intolerable, in which case the psychiatrist will work with them on finding alternatives. Some people need to have a go at trying a few until they find the one that works well for them. So it is something that the psychiatrist, who's the expert in this, will have a very close look at the type of difficulties that you experience, take a good family history and medical history, which will then help them ascertain which medication would be a good starting point. But they can be extremely effective. That's one thing I should add.
So thanks again, everybody, for joining, for taking some time out of your day. I hope you got a lot from the session, which I'm sure you have.
Thank you.